Today at Change Talk LLC, I want to caution today's viewers that this video is not intended for all audiences. This video will cover complex and difficult material, and for those of you that have experienced a major loss of some kind in the past, this video will likely surface powerful, negative emotions, and perhaps even memories we wished we could just simply forget. Remember, there are resources you can call or go to get the help that you need if this occurs. 911 will bring you directly to the hospital or emergency center to get a mental health evaluation in a safe environment. Calling the mobile crisis unit may take hours for them to finally respond to your home, but again, at least you'll have that privacy. And if you have a therapist like me, you should have a personal contact number in case these feelings should arise, for a quick 15-20 minute conversation to process these feelings. When I give group lectures about this topic, generally speaking, out of 12 people, I normally have at least one person leave the room due to powerful emotional response that they typically have, and then will talk to me after group to process these feelings. So please, don't try to soldier your way through the rest of this video if you start feeling worse. Simply pause the movie and return later if you feel as though you can handle the rest of this material. Those are some major advisories, huh? I'm glad you decided to take a chance with me and stick things out. The topic we're going to cover today is both extremely serious in nature and one that we can arguably say being a topic that we've all experienced once in our lives. Trauma. I chose to name this segment trauma and not post-traumatic stress disorder, or PTSD, due to this video going beyond the scope of such historically transient diagnosis that has generally been redefined over the years by recent wars, new research, and associated symptoms. Originally labeled as hysteria, or exaggerated or uncontrollable emotion or excitement, this diagnosis was used during the Freudian days that included some pretty bizarre and unconventional treatments, such as Freud injecting cocaine into his patients. No, don't try this at home. If anything, this is a surefire way of strengthening your traumatic memories through firing up your central nervous system. Trauma was then termed shell shock during World War I, where soldiers began acting strangely after receiving enemy mortars and being exposed to combat. The cure for this diagnosis at the time was that these soldiers simply need to get themselves back into the field, and everything will come back to them. This mentality likely again made their symptoms much worse, and probably got hundreds, if not thousands, of our soldiers killed. World War II brought the term combat fatigue and combat stress reaction, where the government began taking steps towards understanding what was going on with their highly trained and extremely valuable service members very seriously, and began offering psychotherapy as a means towards possible treatment and permanent recovery. Most recently, thanks to the Vietnam War, in the late 1970s and early 80s, we finally began seeing the diagnosis of post-traumatic stress disorder. As a side note, it is also important to realize that professionals such as myself would like to see this diagnosis expand once more to include more causes for trauma. According to the Diagnostic Statistical Manual of Mental Disorders, 5th edition, originally revised in 2013, you must have exposure to one of the following 3 incidents to receive a formal PTSD diagnosis. You must be exposed or experience threatened death, serious injury, or sexual violence. Seems pretty simple, huh? I assure you that it is not. There are currently 2 major types of trauma, acute and chronic. Anytime you hear the word acute, typically it was a one-and-done incident, like a car accident, that imprinted on your mind in an intense and semi-permanent capacity. One could argue during the tragic events of 9/11 that we experienced secondary or vicarious trauma by simply witnessing the unfortunate events of others, or even worse, of people we had a close relationship with, like family and or friends that were in the 2 towers. 9/11 only happened once in our lives, but its reach imprinted on our minds and shook the very foundation of our culture. Don't believe me? Go to the airport, buy a bag of fertilizer, or take a walk around a major city and think about what changes occurred since then. Chronic trauma is just more of the same exposure. However, it doesn't have to be so intense, and usually spreads across a long period of time. Quick examples could include family incest and the much more common domestic violence situations. A third and currently not included category of trauma that has yet had enough votes for making its way into the DSM is complex trauma. One could argue that this could be trauma caused by everything such as bullying, witnessed domestic violence, negative self-image, underachievement, neglect, embarrassment, poverty, incarceration, and the list goes on and on. It's likely this very expansive and subjective list of causalities that prevents complex trauma into making its way into our diagnosis system. But it is just as real as the other forms of trauma. Some red flags that trauma has affected you in a negative way includes deficits in the fight, flight, or freeze departments. In technical lingo, this takes the form of hypervigilance, or a constant ready to fight or flee state of the body. Psychological numbing, disassociation where you zone out or experience flashbacks, avoidance of thinking about the event or going to an area where the event occurred, amnesia or frequent forgetfulness, anxiety/depression, repression, and stereotypical features such as bedwetting. Typically, regression is an extremely common response in children that makes diagnosis that much more difficult. A common example would be Billy, who has enormous energy, forgets things all the time, and was diagnosed with ADHD and oppositional defiant disorder. And truly, he believes that he is a bad kid. Typically, a child like this is hard to control, and will honestly tell you they have no trauma in their lives, which makes you believe that this has to do more with a conscious choice of the child or that of a ADHD diagnosis. However, the way a child is when they experience trauma is that they are often too young to adequately remember the incident in their conscious mind, or they repress or unconsciously bury the incident to be processed later when the child has the ability of doing so. Or someone like Billy hates himself so much that this anger manifests into a standoffish form of depression that keeps people at a psychological distance. By being a child no one wants to hang around, that is fueled by hypervigilance. In fact, when I used to work in intensive in-home treatment programs, 9 out of 10 times ODD and other behavioral diagnoses turned out to be PTSD and modeling behaviors of the parents. Think of modeling like Billy witnessing his father hit his mother on a regular basis to get what he wants. What do you think Billy is doing right now to get that new gaming system? He may not hit his mom, but he certainly knows how to intimidate and manipulate her. Nice thing about learned behaviors is that they are not pathological and can be unlearned. Twisted, I know, but kids are smart and in an unstable home learn very quickly how to survive with just themselves. But what is the reason people experience horrible things in their lives and walk away without a noticeable psychological scar? I mean, honestly, grandparents pass away, people get in car accidents, and others receive terminal diagnoses and seem unaffected. There is a complex answer to what seems to be a very simple question. One possible answer can be found under learned helplessness theory. Dr. Martin Seligman, also known as one of the founding fathers of positive psychology, did much of his important and very harsh research herding dogs with electrified cages in an effort to identify why 1 out of 3 dogs wouldn't give up by simply lying down in their cage or have such a high resiliency for pain that this dog will continue to walk around. It's like that with trauma. Some people see themselves as victims of trauma, their poor health, which can be another form of trauma, and are destroyed and consumed by it, and others are just champions of their trauma and start foundations, programs, and become mental health workers due to having grown from the experience and became stronger because of their trauma. You see, think of an example of trauma like a framed newspaper picture of your house crumbling due to an actual earthquake. You lived in that house when the earthquake happened and lost everything. Each time you walk by that picture of the incident, all those fears, sensations, and thoughts come racing back into your mind. You freak out, and all of a sudden you notice that that picture becomes slightly bigger and has a thicker frame surrounding it, drawing more attention towards it. Typically, trauma that goes untreated becomes worse over time, through this same re-exposure via recurring thoughts and images that creates a deeper imprint on your mind. Short and long-term memories don't exist. There's only one original hard copy version of your memory that is accessed during this access period. So although this fact can be a cause for concern, it is also a reason for hope for people that choose to get help. Imagine if you recalled that image in a therapist's office in a safe environment, finally realizing that you were 4 at the time and are 40 years old now. And now, since your mind is calm and feels secure, you can finally store that memory where it's supposed to go. It's no wonder that your mind shuts down during trauma, due to this being a protective feature of the mind. It's also been proven that during just regular depressed and anxious states, that neurogenesis almost completely halts, and you have a narrow focus of attention. During neuroimaging, these areas of your brain having to do with memory processing also remain dormant for those of you that have experienced PTSD. Hence the reason why therapies such as eye movement desensitization reprocessing therapy, or EMDR, are so effective at treating trauma. This memory reprocessing also occurs at night, and when you don't reach that third stage of sleep, also known as REM sleep, or rapid eye movement sleep, guess what happens? People that have PTSD symptomology generally are able to sleep, but generally never reach the deeper and more restorative levels of sleep, including REM sleep. EMDR activates these same regions of the brain in a safe environment while exposing you to the same trauma in your mind through exposure therapy. It's been proven for 80% of individuals to have significant relief or have been actually cured of their intrusive PTSD symptoms via using therapies such as EMDR. No hypnotism or brainwashing required. You will still remember the traumatic event, and it will always be embedded as part of who you are. However, this memory will no longer consume you. It's equally important to remember that EMDR should be a capstone on your trauma therapy, and is generally a referral made by your primary therapist. Why? Well, if you think talk therapy is hogwash, don't trust therapists, and don't know how to process these negative emotions, how effective do you think this more advanced style of psychotherapy is going to be? Having a primary therapist that understands and trusts you is paramount towards lasting recovery from PTSD symptoms. The last part of the answer to this question of why people feed off of negative juju that trauma brings could be because it is part of their DNA. Epigenetics, or the research having to do with how your genes are affected by your environment, are now beginning to shed some very important light on why certain families appear to be train wrecks when it comes to experiencing even mild traumatic events, and others allow the hits to keep on coming. Let's say that I survived a natural disaster like a tornado, and witnessed my wife get then carried away in one of those science fiction movies. No, this isn't wishful thinking. That extreme event is likely going to affect my DNA, dependent on my perception of the event. Worst case scenario would include telling certain parts of my genes to become silent, since this world is a dangerous place and I have to be on my A game all the time. This redesign is temporary for me and my DNA, but this order is then sent to my sperm to change the blueprints of how my offspring will deal with stress, anxiety, loss, distress tolerance, and so on. Women, thankfully for you guys, you have a much less impact on your children since your eggs largely go untouched by trauma, since you are born with a finite amount of eggs from birth, although pregnancy is a huge factor to consider if you're a witness to trauma. Although keep in mind that this gender inequality predisposition is also now being contested by various researchers who believe women's eggs are affected by trauma more than previously considered. What is important to remember is that trauma does follow our offspring by about 3 to 4 generations. Some helpful quotes that might help you remember this number is that many Native American tribes believe that evil spirits follow us for about 4 generations. And even in the Bible during Exodus, it states God punishes the children of the sin of their fathers to the 3rd and 4th generation. I know, probably just a coincidence, but what if it's not? Either way, it will help you remember this very important fact. So the takeaway from all of this should be that you finally might have the option to choose the path of post-traumatic growth over post-traumatic stress. But this choice generally requires the assistance of a highly trained mental health professional. So what are you waiting for? For every year that is passing, you are getting less potential bang for your buck from a therapist for a disorder that is perhaps one of the most largely treatable in the DSM. EMDR was just one example. There is existential, brain spotting, trauma-focused cognitive behavioral therapy, and mindfulness therapies that are also very effective towards treating trauma. Stay tuned next week when we discuss anxiety and depression and the many faces that appears because of them. See you next time, and thanks for watching.